You may have heard of temporomandibular joint dysfunction, or TMJ, before, but never had to really worry about it until now. So if you or a loved one has a TMJ problem, we'll try and give you a little background here today. For starters, a quick definition. Temporomandibular joint is your jaw joint. It's named after the temple and the mandible, and where they come together is the joint, temporomandibular joint. You can see why we call it TMJ, if only for reasons of spelling it easier. And when we mention TMJ, we often mean temporomandibular joint dysfunction, that is, a problem with the TMJ, because otherwise, a normal TMJ, you don't talk about it much. Your jaw joint is a interesting joint to anatomists because it's a ball and socket joint, and it's also a compound joint. It both rotates and slides, and that lets you move your jaw both open and shut, but side to side, and to a limited degree front to back. And the joint is also interesting to anatomists because although it is a ball and socket joint like your hip, usually the ball and socket do not approximate all the way together. There's usually a little space in there. And just to make things operate more smoothly, that little space is occupied by a cushion, a meniscus we call it, a little cartilaginous disc that will allow smooth sliding motions and rotating motions, normally without any noises or hitches or getting stuck. However, if you have a temporomandibular joint dysfunction, there's three things that can be going on that are not normal. One is pain, and that can be pain from within the joint, or headaches, or muscle tension pain and tiredness, or it could even be referred pain. So you may feel like you have an earache or a toothache, and yet the problem may come from the joint. So that's the first of three main symptoms that we see, pain. The second one is noise. So the joint may pop or click, or make a creaking or grinding or even rustling noise. And these are known as a click or crepitus. Crepitus is that little brown paper crunching noise that comes from rustling something. And then finally, the third of the triad of symptoms is limited motion. So normally you can open your mouth to about an inch, and to open farther, you have to slide your jaw forward a bit. If you can do both those things and move your jaw from side to side, then you have full range of motion, allowing you to talk and eat and stick your tongue out and everything else you can do. If those things aren't present, if your jaw gets stuck, it can become stuck where you can't open very far, or it can become stuck where you open and then later you can't close all the way. Your back teeth don't meet. Other problems with range of motion are you try to move your jaw in one of the acceptable directions and it hurts. So maybe you could move it, but you better not do it because it would hurt too much. So pain, noises, and reduced range of motion are the symptoms that we most often see. We also will see other odd symptoms which, taken all by themselves, are hard to even figure out if it's TMJ. So certain toothaches are from the jaw joint being referred to the teeth, upper or lower, and a lot of times it's hard to figure that out, but that's also pain. Normally we would treat especially if you have all three of these symptoms. But if you have one or two to any major degree, we would probably treat it. So how to treat it? Briefly, we often start out with medicine. It could be a temporary situation that we can alleviate by giving you non-steroidal anti-inflammatories or muscle relaxers. And if those work and you get better, then the problem is solved. Other times we have to do more, like injections. We can inject steroids into the joint like you would any sore joint, a shoulder or a knee. We can inject Botox into the hyperactive muscles and relax those muscles like a muscle relaxant would, only Botox will relax them for several months. Other treatments are an occlusal guard, a retainer-like appliance that spaces the jaw joint out and gives it a more normal anatomical shape and function. And by holding the jaw joint where it would belong and where the muscles are relaxed, the pain situation tends to alleviate. Another treatment that we used to use was surgery, where you would go into the joint surgically, open it up, and remove the little cushion or put in an artificial one or shave bone off the various surfaces where they're hitting wrong. And I will tell you, we did that quite a bit during the 80s and learned our lesson. It hardly ever works out. You often will see temporary relief and end up worse off than you started. When I say often, I mean always. So surgery, do not seek it out for this problem. It's only going to get worse if you do that. So how come your jaw joint is having these symptoms? Well, briefly, it's usually because of excess pressure forcing the ball and socket a little closer together than they should be. And in doing so, to some degree, the little cushion will take up the pressure and allow continued normal operation. But eventually that cushion gets pinched, just like you might pinch a watermelon seed, and instead of crushing it, it just flies out of your fingers when you apply pressure. That cushion will move forward or backward within the joint in order to escape the increasing pressure of the ball and the socket. When it moves to the back, often you can't close all the way. If it moves to the front, you may not be able to open all the way. And when it moves, it often makes a pronounced click or bump, and that's the source of some of the noises you hear. The cushion is held in place by little ligaments that attach to the sides and the front and the back and normally keep it centered within the joint. When you've pushed those bones close enough together and pop the joint out of place and start to squish those ligaments, then you hear some of the other noises, the crepitus and the creaking and the rustling. When you get the bones that close together, you're going to get some inflammation within the joint, that is soreness and irritation. And that's one of the sources of pain from this condition. A really sore joint can also affect the ear, and then you get the ear-associated symptoms like earache or dizziness or tinnitus, ringing in the ears. It also may at that point refer to the upper teeth or even the lower teeth, because things are just really sore. It's a little hard to tell where it's coming from, so your body just assigns a tooth to it, I guess. And then you may start to seek out help because it's hurting a lot. The muscles, as they react to the inflammation from the joint, the muscles in the area of the jaw tend to tighten up. Apparently they're trying to keep that jaw from moving. But once they tighten up on this joint, they only apply more pressure to the already sore area. And then the muscles themselves become a source of pain. They're sore or fatigued or may even be cutting off their own blood supply by being tight all the time and getting what we call ischemic pain, which is a sharp pain from lack of blood circulation. It's the same pain you get from a heart attack, actually, when your cardiac muscle becomes ischemic. So muscles that are tight all the time cut off their own blood supply and may cause pain. So this becomes a vicious cycle where the pressure makes the inflammation stay or increase, and the inflammation causes the muscles to tighten up, which makes the pressure worse. That's why muscle relaxers and anti-inflammatory medications can sometimes break or help to break this cycle. Do you have this problem? Well, some of it could be genetic. If your jaws come from one side of the family on the upper and another side of the family on the lower, they may go together in such a way that they apply more pressure to those jaw joints. Another is frequently over time you wear your teeth down or even lose some back teeth. So if you lose what we call posterior support, in other words, the back teeth are no longer there, or maybe they're worn down short, that allows, when you close, the lower jaw to come up higher toward the upper jaw and force that ball into the socket. And this often occurs gradually over time. Or if you have a lot of teeth taken out, it may occur fairly rapidly. Well, I think that's more than you wanted to know about TMJ. So thank you.